Hey, so welcome to today's presentation on strategies for recovery influencing loved ones to start treatment. My name is Molly, and I'm one of the managers of mission initiatives here at the National Eating Disorders Association. I'm so excited to welcome you all here. I'd like to take a brief moment before we get started to talk a little bit about the National Eating Disorders Association and the work that we do. NEDA is a nonprofit organization working to fundamentally change the way eating disorders are understood and treated, and to empower those affected to achieve lasting well-being and recovery. Through campaigns like Eating Disorders Awareness Week and through our Campus Warriors program and NEDA Cares events, we are working to increase public understanding of these complex disorders. We also provide information and resources through the Grace Holland Cozine Resource Center, as well as through our educational programs like the Understanding Eating Disorders presentation and webinars like this one. Additionally, we promote early intervention through our screening tool, which has helped over 1 million people. We have also invested in groundbreaking research that helps to develop effective treatments. If you would like to support our work and more programming like this webinar, we'd appreciate any donations, and I'll include the link in the chat later on. Now I'd like to introduce our esteemed presenter, Eleanor McAuliffe, a counselor licensed in both Louisiana and Virginia. Through a private practice, eating disorders counseling and education, Eleanor provides a number of services, including interventions, therapy, supervision, and education. As a trained clinical interventionist, Eleanor travels to help families support their loved one into treatment for their eating disorder. As a counselor, she provides individual and family therapy in New Orleans and Louisiana. And if you have any questions during the presentation, please share them in the chat feature, and I'll relay them to Eleanor at the end of the presentation during a period for questions and answers. And now I'll turn it over to Eleanor. Thank you so much for being here and sharing this wonderful topic with our community. So I'll just let me stop sharing.
Yep. There we go. And I will start sharing. And there we go. You can see that okay, Molly?
Yep. Yes, we're all good.
Okay, great. So hi, everybody. My name is Eleanor McAuliffe. I'm really happy to be here today, especially it being World Action Eating Disorders Day. And I'm just really happy to be a part of the webinar series for NEDA. If this is your first one that you're attending, you'll have access to all of them on YouTube if you go to the NEDA website, including this one. So anything that you feel like you haven't caught or want to go back over again, you'll have the link to be able to do that, which is another really helpful thing. So really the purpose of me doing this webinar, Strategies for Recovery, Influencing Loved Ones to Start Treatment, is, families and friends, support people, I'll use those terms interchangeably. Really anybody who is dealing with a loved one who has an eating disorder, I want you to understand that you do have some agency and some actions that you can take to help your loved one who has an eating disorder. It can feel very helpless and hopeless at times, and that's where myself as a clinician, I am always going to hold the hope and the belief that there is, a better way of functioning. There is hope in recovery. And so you're not the only one struggling with this. For those of you who are coming on as support persons, kudos to you. Not necessarily have ever been taught these things before or didn't even think about some of these types of things before, because this isn't, a textbook that families are given. It's not until you are working with somebody or have a loved one who has an eating disorder that you realize I don't necessarily know what I'm doing. So that's why I really do appreciate these webinars. That being said, I do want to acknowledge that each person in attendance is coming from a different circumstance with a loved one. Maybe this is the first time you've ever attended anything having to do with eating disorders education, or maybe you're a loved one, or maybe your loved one has been struggling with an eating disorder for years and they've been through maybe multiple treatments or multiple treatment episodes. And so what we're talking about today can be applied to any stage of eating disorder treatment or recovery. And when I use treatment, I'm really referencing anything from the lowest level of care, which would be typically an outpatient setting where there's a therapist and a dietitian. Maybe you're seeing them one time a week, all the way to the highest levels of care that provide 24/7 support, residential, inpatient, and all of those in between. So maybe you're here because you've just identified that a loved one is struggling with an eating disorder and want to figure out what to do. And again, maybe you are also coming from the fact that you've been dealing with this for a long time and want some refreshers or want some new ideas of how to help support a loved one. So, yeah, some of you also, I want to, provide the caveat that some of you might see some of the things that, some of the strategies that I'm providing or suggestions and say, well, I've done that before. I've done that. And that's the tricky part is eating disorders are very, um, they're frustrating to deal with, but I'll remind you, it's the eating disorder that is frustrating, not the person with the eating disorder. And sometimes it takes a lot of education and going round and round, but really consistency is key here. And that's what you'll hear me reference the whole time. That also being said, these are helpful strategies and suggestions, but it doesn't encompass all the support you might need as a loved one or as a caregiver, family member, support person of a loved one who has an eating disorder. So I will continue to stress to have your own support system, whether that be working with a therapist who, just for yourself, but also maybe one who works with eating disorders. So you kind of know the do's and don'ts and how to be helpful. Going to support groups for family members with eating disorders, maybe getting a coach, an eating disorder coach. We have coaches that work with individuals who have eating disorders, and we have coaches that also work with family members and support persons. So again, those are things that I'll continue to emphasize throughout the presentation, and I really want to emphasize that is this is just a piece of the puzzle that I'm hoping can be helpful. So what are we doing? The objectives. Basically, we're going to incorporate all of these things into combine them to show how do we effectively support or encourage a loved one into treatment. And again, whether it's the first time they're ever getting help for their eating disorder, or this has been a struggle for a long time and we need to regroup or get back into treatment. So objectives: effectively use influence and leverage of love. And that's where it really mixes with the idea of establishing appropriate boundaries or limits with a loved one. And in those two objectives, we're going to talk a little bit about what's the difference between boundaries, limits, leverage, and that nasty little word we call ultimatums, which is what I think a lot of family members and loved ones are going to think about, like, but you're telling me I need to do an ultimatum with my family member. That's not the case. And we'll talk about that a little bit more. A big part of this for you as a caregiver, as a family member support person, identifying responses to a lot of those common treatment objections. So part of the eating disorder is denial. That is a symptom of many eating disorders, a denial that there is a problem or denial of the severity of the problem or the need for like purposeful treatment or treatment protocol. But there are also going to be objections just about why treatment can't fit into their life right now. And so the best thing you can do, and that's overwhelming, right? Think about the person with the eating disorder who may in the back of their mind know, I do need more help and support, but how could I possibly figure out the rest of my life and try to do treatment? And so you as a support person can do a lot of help by coming up with some of those potential solutions, not to control the person's life, but to say, hey, don't worry, like we're going to help you through this. You're not having to make these decisions completely on your own. And then applying a specific skill, which I like to reference as the RVE skill, which stands for reflect, validate, empathize, and we'll go into that. How we utilize that to de-escalate tense conversations as you're trying to encourage your loved one into treatment, and basically utilizing that skill to then come back into how do I provide some responses to those objections to treatment. And so just, again, all of this will make sense as we go through it. My thing isn't working. There we go. So to backtrack before we get to the specific skills, what gets in the way? Hesitancy, denial, and this myth of somebody needing to want help. So one of the biggest roadblocks I find when trying to help someone with an eating disorder is there's this belief that somebody needs to want help in order to benefit from it. And that is a deeply ingrained myth in society as well as in the profession, I'll say. When I first kind of came up as a baby therapist, I was kind of taught that, well, somebody's going to need to want the help before it'll ever benefit them. But what we have to remember is um, with any mental health issue or other issues, sometimes it's not until somebody can kind of put the mirror in front of us to say, like, this is a problem and you need help. And also, if we think about the malnourishment across the spectrum of eating disorders and symptoms, there's malnourishment going on, which impacts the entire body, including the brain, and being able to make, the best decisions for themselves. And then we go into the psychological components of how the eating disorder feels like it's helping the person who has it, even though it's not. And so those are things that you have to realize are in the way of somebody ever wanting treatment. Um, in reality, the denial, the hesitancy, um, they're not just, they're not, eating disorders aren't just behaviors, they're protective strategies. And what may look like resistance is often more so a complex mix of fear, of shame, of judgment, um, and typically, too, a belief that somebody doesn't believe they are sick enough with their eating disorder. There's a lot of comparison that goes on in eating disorders, and uh, that's also the part where, clinicians, trained treatment teams, and family and loved ones who become educated about the misperceptions or the distortions a loved one has who has an eating disorder, how we can come back to kind of help them. So it's really helpful if we can shift our language. And instead of labeling somebody as like being difficult or resistant, maybe it's more that they're ambivalent, right? And they're doing some type of self-protection. And that really helps us understand more and live out more like the compassion that we need to reflect to our loved ones with eating disorders. So they don't feel there's a lot of, beliefs and feelings that one is being judged, right? Because the stereotypical thing is just eat, right? Eating disorder, that would cure everybody, right? If you just eat. Well, if it were that simple to just eat, then then it would be, right? Then people wouldn't have eating disorders, but it's not that simple. And so if we can help the person understand, like, we're not judging them, we have compassion for them. And it's also more clinical, if there are clinicians on here, we're really talking about too, like a more clinically accurate picture of the person. It's not that they are being difficult. It's that there's a fear of letting go of this thing, the eating disorder, which has been there to help them in some way, shape, or form, which, as a lay person or family member, you may not completely understand. But as you engage in things like these webinars, hopefully you're beginning to understand kind of what it's like to be a person with an eating disorder. Um, I also want to reiterate that any person, feeling like they've delayed trying to help their loved one with an eating disorder, or they feel like they've tried and then they set it aside, and now, like, even here it says, like, we shouldn't wait, right? Waiting for readiness is just going to prolong the suffering of the eating disorder, not just for the person with the eating disorder, but the family. Everybody is impacted by this. It takes a village to get to this point of having an eating disorder, and it takes a village to get out and into recovery from an eating disorder. But I want to reiterate that nothing is about fault finding. The the point of the matter is, like, you are here now and doing what you can do, what is in your control, what is in your agency to help your loved one. So the point is not to say shoulda, coulda, woulda. It's okay, I'm learning some things that I can do right now. And then the most important thing I think to say about this too is just because somebody doesn't have motivation right now or are resistant to treatment, we know that as somebody gets into recovery, especially as we go from malnourishment to a nourished brain, a nourished body, things are functioning better. That's when we find the motivation to continue treatment and to continue recovery. And it's a tough battle, that especially those beginning stages. It's interesting because those beginning stages of recovery are pretty difficult But then that's just the first phase, and each phase has its own difficulties and obstacles. But right now we are focusing on that first phase of just getting somebody into treatment so they have the chance to heal the brain, to heal the body, so then they can do the therapeutic work that will increase the motivation. So that's what I want to say too, is just because somebody is highly against treatment does not mean they can't benefit from it. Yeah, so I just wanted to make sure I was looking at my notes to make sure I covered everything. All of a sudden, my little PowerPoint thing isn't working. So what am I saying? I'm saying you should force your loved one into treatment. No, but kind of. But this is where we get into it's not force. Like, that's a strong word. I'm talking about encourage and support, right? And so one of the things that's really important to remember is, it's the way you think about it and perceive it, and how you help support your intentions, and share your intentions with your loved one. Um, just as like a personal, professional self-disclosure, but it really goes along with this. As a baby therapist, my foundational training was truly in cognitive behavioral therapy, and there are a lot of um, points and training and um, things that go along with this, and how you use a CBT lens. And, at the beginning, as a baby counselor and novice counselor, I found it really difficult to get my clients engaged in that process, or really buy into it. And then there was this like kind of switch, this change, that like I started to practice what I was preaching in terms of actually utilizing the CBT foundations and their different techniques for myself. And in doing that, I finally was practicing what I was preaching. And so that changed the way I was able to teach it myself, to encourage or work in the therapeutic process. And then I found my clients being really responsive to it and engaged in it, and buying in, if you will. And so I like to use it as an example, because it wasn't until I practiced what I preached that I could do the work. And so this is where perception matters. And if we're talking about supporting your loved one into treatment and getting help, we have to reframe. And this is something that your loved one is going to learn too in their own treatment, is reframing how you think about it. So instead of forcing, okay, I'm insisting on care. I'm ensuring safety. I'm not forcing, I am taking necessary steps. So in essence, I'm not trying to force you to do anything. I'm ensuring your safety by insisting that we get necessitated treatment. So it can be helpful to use this language, not only in how you want to explain yourself and your intention to your loved one, but also how you're talking to yourself. That negative self-talk could be like, oh, they're just going to think I'm giving them an ultimatum. Oh, they're just going to think that I'm forcing them, and they're just going to be so mad at me, right? If I'm thinking that way all the time, I'm not going to be the best at um, sharing and really going by that intention of, I'm trying to support and encourage you, not control you. So just be thinking about that in anything you do with your loved one. Think about how the perception of what you're saying to yourself is going to impact how you come across to somebody. So ultimatums and leverage. I want to clarify some things about this, because many families wrestle with the idea of an ultimatum. But there's this thing called healthy leverage. And what is the difference? And I will just say in general, I have people argue with me all the time, like, well, what you're saying leverage is just another ultimatum. You're just using a different word. Okay, you can argue that. Again, it's about that perception. And this is, I'm not going to necessarily read these exactly, but, ultimatums tend to have a bad reputation for sure. Most family feel uncomfortable utilizing them. They can feel harsh. They can feel like you're forcing someone into a corner or backing them into a corner. Um, families worried that if they use an ultimatum, it's going to damage the relationship. It'll drive the person away. And let's just put it out there. The eating disorder, I always say somebody who's within an eating disorder is in isolation. Somebody who's in recovery is a part of community. And so there's nothing more than that eating disorder voice wants than to have a reason to push away from people, to isolate. So yeah, that is a worry. And honestly, when the concept of what it is used, using fear and frustration and anger, they definitely can and will be experienced as threatening or rejecting. And even you, as the person who might have an ultimatum, right, you're going to feel that I'm doing this because I'm angry, versus leverage, LL, like leverage of love. I want you to really think about that. How do I show them that I love them? I'm going to use the leverage that I have. So yes, there is this other path. Using leverage is rooted in love. Um, and it's about having boundaries, and it has this intention to protect. So leverage is about recognizing what forms of support you as a family are offering, whether it's emotional, financial, social, but aligning that support with your loved one's wellness and their safety. And that's what we're really going to talk about, is how enacting leverage and enacting boundaries and limits, you're protecting your loved one and yourself, because you as loved one, as you as caregivers, as support persons, like you need to be protecting yourself as well. Otherwise, you won't be in the best place to help your loved one support in their recovery for an eating disorder. So instead of saying things like, if you don't get help, you're out of my life, I'm kicking you out of my house, using that would be an ultimatum. Using leverage would be saying something like, we love you too much to enable this illness, and I'm not going to do anything anymore that would enable you to continue to listen to your eating disorder voice. So using leverage is definitely an approach that is moving against any type of enabling behavior. And those are enabling behaviors are those behaviors that, perpetuate an eating disorder, or accommodate the eating disorder. And using leverage, again, the love of leverage, the leverage of love, is very compassionate, and it's effective. It's much more effective than going with a harsh ultimatum. That being said, just like you as support persons, families, caregivers, um, I really strongly recommend that you have your own type of support, whether a therapist, a coach, support groups, groups where you can interact with other, support persons who also deal with somebody with an eating disorder, right? Um, you all as a family need to commit, and this is when I say families, I'm incorporating all support persons. Families need to commit to treatment and long-term recovery with their loved one, alongside their loved one. Um, I've always said to patients with eating disorders that the fact is, right now, you might be the identified patient, which in their perception could be the identified problem or the problem. They're the ones that need treatment, everything's all their fault. And there's, to some degree, that's how, you know, those with eating disorders can feel and be treated by families, or support persons, and not realizing that the family is not a cause, but a huge contributing factor to engaging in eating disorders and in recovery. And so, however, I like to put it back on the patient, saying like, okay, but because you are in like this identified treatment, let's say you're in a residential facility with me, because you're doing this, your family actually has a chance to get the treatment that they need. It might be under this guise that, oh, in order to support, Jacob, mom and dad have to now be in this family therapy, but mom and dad needed their family therapy regardless of Jacob's eating disorder, right? And so in 20 years from now, I always kind of like to say, like in 20 years from now, if your family is kind of happy, healthy, enjoying the holidays together, right? The eating disorder is, a thing of the past, and you find communication with them is great, right? Can you can you be okay with the fact that at the beginning of this, you were the problem that needed to be solved? And sometimes it's really a backdoor way of getting family members who could benefit or need their own therapy. Let's say a family member who has had, traumatic incidents happen in their life, right? Which then again contributes into maybe how we got to this eating disorder. Again, that would be a whole other presentation, but it's just important to note that in part of the leverage here is also saying, I am getting help, I am getting treatment, I'm getting education. So leverage is not a punishment because you wouldn't be punishing yourselves, right? To help the person with the eating disorder. Although some people are very selfless and they would. But it's also noting that some choices rightly come with unpleasant consequences. And so we're setting up new expectations about how our relationships are going to go. So types of leverage. I'm not going to go too in depth with like specific examples for each type of leverage support persons can apply, because the type of leverage you have and the way you would appropriately utilize it, and notice I say appropriately utilize it, that's really going to depend on the context of the family, the person with the eating disorder, the power dynamics, right? Minor and parents, young adult, financially dependent on parents, an adult who, is completely independent of family, in terms of finances and things like that, but maybe not so much like support, like emotional support. So this would be a longer presentation, and if you have questions specifically about how can I use this as leverage, or would this be appropriate, that's like a further conversation. So I won't be able to answer those specifically. But family and home includes things like housing, financial support, access to privileges like a car or a phone. Um, Cars are a great one because it's a great metaphor for, if I saw a family member who was inebriated, drunk, intoxicated, right? And I saw them trying to get into their car and drive away, like I'd be grabbing their keys. We have the same issues with somebody with an eating disorder, and that's, just my observation. You can't tell how severe, the medical or physical complications are. And so how can I allow you to get behind a car if I know you've been purging multiple times a day, every day, right? I don't know what's going on with your heart. I don't know if you're going to have a seizure, right? So ethically, safety wise, I can't let you have access to the car, or I won't be paying for the car, those types of things. So that's just like an example, but you really want to frame these things around values. We want to support you, but not the eating disorder. And that can make a big difference in how you share why you might be instilling some of these boundaries or limits. It's not about the ultimatum. It's about, I can't, in my right conscience, continue to give you these things or provide these things um, if you're not, working on recovery, or if I don't get, medical clearance from one of your providers. Um, in this part, it's really helpful if you can have like an extended family member or a mentor involved, because, the day-to-day nuclear family or nuclear support system, right? Like that's where a lot of the conflict and arguments arise. But if you can have, let's say, grandma who's like in the picture, but not in the day-to-day picture, but let's say Jacob would do anything grandma says, right? If grandma kind of comes in and says, hey, I'm worried about you and I really think you need treatment, maybe they're going to be more apt to listen to that than you, the parent, which is frustrating, right? But at this point, it's not about how they get into treatment. We need them into treatment. And so again, you as the support person, if they don't listen to you, but they listen to grandma, can you be okay with that 20 years from now when, Jacob is happy, healthy, flourishing in life, but he only went to treatment because grandma said it, right? I think you could live with that if everybody can have a happy, healthy life. And then the biggest thing with this too is not sweeping things under the rug. Typically, if you're talking about leverage, and I think what many of you might have seen or heard in terms of substance abuse treatment is that, sometimes people cut somebody off completely. If you don't get into recovery, if you don't get sober, you're out of my life. And substance abuse, that's a whole other, presentation about how you utilize that type of leverage, but that's typically not my go-to here, because like I said, eating disorders love, 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 isolation. And so that's what we really want to, focus on, is not allowing the eating disorder to get what it wants. Um, academic or professional, these are kind of self-explanatory. Think about the leverage you might have in terms of school enrollment or medical clearance requirements, especially if somebody's a minor and you're a parent. You can have those conversations with school and let them know. And a lot of times schools can be your best ally in saying, yeah, Susie Q, you're not going to be able to start this year, like this semester, until you get some of these other things, until they're being treated. Using things like coaches or administrative involvement can be really helpful, because again, the coach can be like a mentor, right? Saying like, hey, I know things aren't okay and I want the best for you. I care for you and I can't, consciously allow you to play this sport right now when I know you have an illness that hasn't been taken care of. You can also, sometimes it can be helpful to use uh, employer and employment concerns. And this one can kind of be controversial, but definitely when I've dealt with kind of more, and it's not about the severity, but like really when somebody's life is in immediate danger, sometimes going to employers can be helpful because they don't understand the liability of what's going on. And eating disorders, a lot of times people can really mask what's going on. So things like figuring out what somebody's FMLA coverage is, or how do they take an extended leave of absence, those types of things. And a lot of times with many companies, you can call HR and anonymously ask, what are the protocols? How do you handle this? How would I get my loved one, my person, to do this? And then licenses and certifications to practice. I've dealt with my own, licensing board in Louisiana for some clients who, were impaired because of their eating disorder. And so we needed to use that. And that was, again, you don't want to have to go to that leverage, but for the particular case I'm thinking about, it's actually been very, very helpful because it really is the thing. She doesn't have like family or other things that um, can kind of help keep her motivated. But the idea of, I want to do this, this is my livelihood. I love being a therapist, right? And I have to be in recovery and I have to be in a good place in order to do that. Um, and then clinical and legal leverage. I think recommendations from doctors and therapists is underutilized. And I say that when your loved one may not be under the treatment of like eating disorder, like specialist providers. However, I've worked with a number of, PCPs, trusted, internal medicine doctors of loved ones who have an eating disorder. And as soon as you have that conversation with them, hey, this is what's going on, it clicks in the provider's head. Oh, that's why they're having these physical complaints. And then also, well, yeah, this would be the recommended thing, is to get treatment for this. And so those can be trusted providers. Now, you also have to be thinking about HIPAA and confidentiality. Um, Sometimes we have family members that, are on all the releases of information, so they can speak freely about it. However, you always have the right to share information with providers. They just, may not be able to confirm or deny that they're even seeing that person, and they certainly may not be able to provide you any information. But they can receive that information and they can say, hey, your mom called and she talked about this and I didn't tell her anything. In fact, I acted like you may not even be my patient, even though underlying we all know that you are, but that can be really, really helpful. And then motivational consults with treatment centers. So somebody saying, I'm not sick enough, I don't need to do this. Okay, well, if you're not, like, let's do a couple of assessments with a couple of, facilities, right? Because they also have to provide the appropriate recommendation. If you don't need their level of services, they can't admit you because insurance would never cover that. And they also will provide like what level of care. So yeah, if it's somebody that, has been struggling for the past few months and maybe we're not jumping to, the highest level of care, they also can tell you the recommendation of, okay, we think starting an outpatient treatment team is going to be helpful. And then these last two, we really try not to go to, but custody, in terms of safety issues, just like somebody can, who might be on substances and not making correct decisions for childcare, same thing can happen, with eating disorders. And then also, legal, ramifications. this is where we might get into somebody who needs a conservatorship or a medical guardianship, something like that. But that would be a whole other presentation. But I just want you to know that those things are out there. So leverage is setting boundaries and limits. However, it's a way to protect and not punish. You are protecting you, not only your loved one, you are protecting you. It protects their well-being and yours. It relates, or it keeps your support tied also to their safety. Leverage shows love and concern, not rejection. It's saying we can't keep supporting you in ways that allow the eating disorder to continue unchecked. However, it's the fact that like we love you too much to pretend everything is okay. What I find is like the lack of follow through with boundaries becomes the problem. Because if you say, I won't support this, I'll be happy to drive you to all of your appointments that you need to, but other than that, you know, I'm not driving you places because it's unsafe, or I'm not allowing you to use the car, it's unsafe, right? But then if I don't follow through on those boundaries or those limits, then the person with the eating disorder actually gets the idea of, you see, it's not that big of a deal. They totally forgot about it. Leverage and boundaries, clarify what you can and cannot support. It becomes this honesty about your comfort level and ensuring harmful behaviors, aren't enabled. We can't keep doing this unless you agree to work with a professional. That's not abandoning. That is saying that, there are only certain things that you can allow to happen, and without putting yourself in harm's way. They also create healthy relationships, actually. It keeps them respectful, balanced, and centered on safety. We're here for you, but we need to see you take steps to get better. And again, you keep validating. We're not saying this is an easy process. It's not as simple as get into treatment and then everything's hunky-dory. No, but just like you're trying to respect them and what they want or don't want to do, because at the end of the day, especially if they're an adult, like they have the right to say no. But it's also reciprocity, is like they need to be respecting like how this makes you feel, how this impacts you. And then leverage also helps us separate the person from the illness. So again, if we talk about somebody refusing to cooperate with treatment, but really like you are now refusing to cooperate with the eating disorders demand. So you're not going to do anything that would enable the eating disorder. So now we get to the skills. And where we start with that is actually looking at objections to treatment, and how you, as a family member, as a support person, will come up with solutions to those. Just checking time. Going slower than I thought I would. So we have two different types of common objections to treatment. We have things like work, school, finances, childcare, obligations, which can be family obligations, organizations, holidays and events, right? I can't go to treatment right now because grandma's 95th birthday is next week. Sports and activities that really, a lot of times for adolescents or young adults, college students, like that can be obviously a huge thing. Even friends and socializing, like how can I leave my life to go to treatment? I can't put my life on hold. And then even just the stigma of treatment can be, a concrete objection. Like, what are people going to say or think? Or what does it say about me? And so I want to say, like, all of these concrete objections, like they are true and valid. Not everybody can just take off work to go to residential. Or, if you're working like an hourly job and you work at certain hours and you need to see, three different types of providers, like that can be hard to do. So as the support people, you need to help. It's helpful. It's not like you need to, but in order to support, you can be coming up with what are some solutions to these things. Now we also have objections based on opinion. So I'm perfectly fine. It's not that bad. I can handle this myself. You're blowing this out of proportion. how do you think I got this way? It's your fault. The most important thing to note is when somebody gives you an objection to treatment based on opinion, you don't want to respond with another opinion. And that can be really hard. This is where we might come up with, this is where we get into some of the arguments and the tit for tat, and that's what you really want to stop doing. And so now we're going to talk a little bit about like objections. And I just want you to come up with like a clear like response to it. I'm not asking you to say anything fancy or come up with the right way to say it. So basically, here are 4 examples. I'll read them each out loud, but I would like a couple of you to write into the chat which number you're responding to and just give us an idea of how you might find a solution to this objection. So the first one, I don't have time for this. I work 8:30 a.m. to 5 p.m. You're saying I need a therapist, dietitian, and medical doctor each week? There's no way I have time for 3 appointments each week. Number 2, tennis tryouts are in a few weeks, and I'm not missing them. I want to be captain next year. Number 3, it's funny you think I'm made of money and can just walk away from life for a few weeks. I have a household, I have bills, not to mention my kids. And then number 4, which I'll just put out there, I think can be one of the hardest ones to come up with a solution. This is your fault. You expect me to do what you say. If you hadn't put so much pressure on me to be perfect, none of this would have happened. So take a second and just type in, the chat 1, 2, 3, or 4, and just what is a general solution. And Molly, if you could help me with that. Trying to see if I can find the chat anywhere. I can't.
Don't see any responses coming in yet.
That's okay. I've also got some.
Great.
Wait, there's the chat. Maybe I'll see something.
Yes, we do have one. You want me to read it or?
Sure, please.
Okay.
Yeah.
For number 3, I hear your concerns and I get that, but you can't afford not to take care of yourself. We care about you and can help with some of these things.
Yes. So what I really appreciate about that response is, you're kind of ahead of it with when we're going to go to like practicing, like reflecting, validating, empathizing, but you noted that it makes sense that this is, like a true reason not to go to treatment. And part of the solution is we're going to help with that. Great. Any other ones, Molly?
Yes, we have a few more. Number 4, I know I need to learn about how to help change things so that your health and our relationship will improve.
Yep. And that was the one I was kind of most concerned about with people responding is that's the type of objection where you do want to own for yourself where, it's valid. I need to learn more about this. We need to figure out ways to all heal. So that's great. Let's just do one more if there's one more in there.
Okay, so number 1, if you can find 60 minutes a day for TV or friends, you can find 60 minutes a week for a therapist.
So that's where we're getting a little bit more into kind of opinion, right? And it's true. You and I might say that. Well, I know she goes to get her nails done each week. I know, she goes out every Friday night with friends, which are all great things, right? Self-care. But I do appreciate that response because that would make sense. But that logic for you is going to be interpreted probably for the loved one as like they're not understanding how busy I am. So that's why I came up with some ideas for some of these. So the first one might be that if, again, in a perfect world, you've had time to kind of look at, some of these things, we want to talk about like the objections, but saying like, guess what? We found a nutritionist who has weekend availability. So you're not going to have to, miss work for that. The therapist that we found is, just a block away from your office and has evening availability. And then the doctor, yeah, you're going to have to start seeing them weekly just to start off with, but that will decrease and they'll be able to do virtual appointments, let's say once a week or once every other week during your lunch break. So again, these are all great examples and attempts, and it's just about kind of refining them. How do I? So this is just then we just kind of took a stab at it, right? Appropriate responses to objections. But for you and your loved ones, you really want to brainstorm for all the possible objections. And that's where you kind of go back to that list of what they could be. And you want to write out potential answers or solutions for each. And it's not about this tit for tat. Your loved one says, okay, I'm going to do it. I can't do it because of this. And you immediately have the response. We'll get to how you how you do that. But you want to practice your responses in a loving and caring way. And then, like I said, objections based on opinion, don't use opinion, try to change the person's mind, go with facts. For instance, this idea of you're blowing this way out of proportion, right? You as the parent, let's say, could say, what do you mean I'm blowing this out of proportion? You went to the ER 3 times this year, and I had to go and sit and watch you in agonizing pain. That's not blowing it out of proportion, right? That's just getting into that tit for tat. You want to be calm and collected and say, I think your PCP agrees that having had 3 ER visits in the last month is not blowing this out of proportion. Your health is in serious decline, and that's showing it. So really, it's about slowing this down. So once you've kind of thought about the boundaries and the limits that you're going to have, the leverage, you've identified a lot of possible objections to treatment, then you want to utilize the RVE skill, which is reflect, validate, and empathize. Reflecting has to do with exactly what the word suggests. You're basically just rephrasing, paraphrasing the content of what's going on. So if I heard you correctly, you said finances are a reason you can't go to treatment. Then you want to validate. That's letting the person know that you understand the meaning behind what's going on. It's the process of letting the person know that you can get where they're coming from, and it doesn't mean that you agree. So again, the example of maybe the loved one with the eating disorder blaming you for why they have an eating disorder, it's not that you might completely agree with them. Maybe you say like, yeah, there's some contributing factors. But you can say, I can understand where that's coming from because, yeah, I put a lot of pressure on you as a kid. And so that makes sense. And then the empathy piece, is definitely trying to understand the feelings being expressed underneath the message. And that goes a long way because what happens is when you use this technique, typically when we're in conversations and especially difficult conversations with people, is you as the support person, you might be listening to respond instead of listening to understand. And so what happens is when I'm listening to respond, I'm just coming at it with the opinion, with the absolute solution right there. And so it doesn't give the person, the loved one with an eating disorder, it doesn't give them an understanding like they're not even listening to what I'm saying. They're just trying to fix it. Like I'm just this fixable problem. But when you use this technique, you're slowing it down and you're sharing with the person, like, I'm listening to understand. So that's the first piece is listening to understand using reflect, validate, empathize. And then we come back to the the objection. So I know I'm getting to time, so I'm going to go through these kind of quickly. But example A, the person says, you can't make me go. You have no idea what this is like for me. You don't get it at all. I'm finally making progress in my life. And so this bottom part is, and I've highlighted kind of the pieces of the reflect, validate, and empathize that you're trying to get in there. So yeah, you're right. You have accomplished so much in this past year. And let's say they're referencing their work, okay? I also know how overwhelmed and stressed you've been, and I can hear how alone you feel with it all. And so especially that piece about being alone, that's directly making the inference from you have no idea what it's like for me and you don't get it at all, right? So that's the empathy piece. I can hear how alone you feel with it all. And then the validation too, it makes sense that you wouldn't want to give up the things you think have helped. So let's say this person got a promotion at work this week or this year, right? Like, why would they want to stop working when they just got this amazing promotion? So this right here is that listening to understand. And then we can hit back with, it's not really hit back, that's just my saying is, we come back around to the objection. So furthermore, you as the support person, it's not fair that you think you must be a superhero. I know you're worried about taking off work, but we've already explored that through looking at those objections that the person might have, right? Your boss thinks that your health is the most important thing right now. She's already spoken with HR and approved an extended leave. She's happy to take on your accounts right now. If you accept this help, you won't have to feel so alone. And so this is where we come back to we listened to understand. And now we've taken a lot of time that our loved one doesn't even know to think about how do we find solutions to the objections. And you've contact maybe her boss is a really good friend of hers too, and you all know her, right? So you all have had this discussion and we can make this work. Example B. So the person says, and this is a high school kid, will say, I'll never speak to you again if you send me away. What will my friends think? Junior year is the hardest and I need to keep up my grades. So again, the second part is I've, highlighted some of the things that would go with the reflecting, validating, and empathizing. So you as a parent might say, I can understand why you'd be angry with us and worried about what you'd tell your friends and finishing 11th grade, right? So you've inferenced the anger because she started off by saying, I'll never speak to you again, right? And the worry that she has both for what she tell her friends and then also like grades and finishing school, how she's supposed to do all of that. I'd have the same concerns. It makes complete sense. So again, listening to understand everything that she has said makes perfect sense. It makes perfect sense. And we can figure out how to make this work. So we come back around to the objection. We love you so much and we'd get you treatment for any illness. So it's no different for this eating disorder. We want you to be able to enjoy the last years of high school, and that's just not possible right now. Stella's mom called us because Stella has been so worried about you and doesn't know what to do. Your friends love and care about you so much. Your school counselor said that we'll be able to figure out all of your classes. Your dad and I are also expected to participate in our own treatment, so you won't be doing this alone. So again, this is like a perfect cookie cutter answer, which it doesn't always turn out like this, but it's just an example of all the things that you can incorporate to speak to their concerns that you've already validated and empathized with, right? And recounted. And some of the things that you've already come up with to figure out like how do we move past these obstacles, which are true obstacles, unless we find a solution. Um, so now, again, time to practice, and I think we really only have time, to do one of these. So let's go with green, the second one. So the person says this, and then I want you to remember to use the reflect, validate, empathize, respond to objections. So what does the person say? I can't do this. I can't leave my life. I have Beth and Joe's wedding coming up. There's my dog Rufus. I'm in charge of the charity gala in 2 months, and I can't plan that if I'm locked up in a facility. I'm sorry, but there's just no way I can go to treatment right now. I'll work on this myself. I promise you. I promise you I'll do this myself, but I just can't go right now. Again, I'm not expecting any perfect responses, but how might you reflect, validate, empathize, and then come back to respond to the objection? And Molly, you let me know if anybody
Will
is
do.
able. Yeah. And if not, don't worry. Because this is hard to do, like incorporating it all at once. Anything coming in?
No, not yet.
Okay. Well, for the sake of time, I mean, if somebody brings something in, do let me know. But
Here's one actually.
okay, yeah.
Okay. I hear your concerns. I know you have a lot on your plate and are super busy. I get that it's a lot to go to treatment right now, but this won't take care of itself. I support you and want you to get the help that you need.
That was lovely. That was so lovely. Because you acknowledged for them that they do have a lot going on, right? You've heard them, and that it would be a lot to go into treatment right now. But again, like this stuff can't just be taken care of on its own. What I would, again, y'all had to do this very quickly. So the things that you might add into there, right, is like she mentions Rufus. Like I've I've already discussed it with, my partner, and like we are happy to take care of Rufus while you're gone. And we already talked to Jennifer, from the charity event, and she knows exactly, like y'all are co-chairs. She knows exactly what she needs to do. So you don't have to worry about that. Now, when it comes to Beth and Joe's wedding, those are things that can be really dicey. For some people, it's like, hey, Beth and Joe want you to be happy and healthy. And so if you end up having to miss their wedding because of treatment, like they are going to understand that, and they're going to be more happy to celebrate with you after their wedding when you really have the ability to enjoy the time that you're spending together. So everything you said was like spot on. And it was, we're thinking about what are some of those objections in there that we want to like specifically respond to. But again, we didn't have a lot of time for that. Um, so kind of a wrap up in questions, common difficulties. Typically, and we talked about this at the beginning, waiting for a crisis to justify intervening. What I would like to say right now is if you're attending this and there's, a specific reason you're attending this, like there is a loved one in your life that you're like, I need to support them. I need to figure out how to really encourage them into treatment. Let this be the thing that says, okay, I'm going to start preparing for this now. So it doesn't mean that tomorrow you're having the conversation with your loved one, but going back over, okay, let me brainstorm all the possible objections my loved one would have for not, engaging in some type of treatment. Let me think about how I would respond to that. What are going to be some of their responses? And how can I reflect, validate, and empathize those? And then come back to say, like, hey, I've also started brainstorming how we can, get through those obstacles or objections to treatment. Um, the fear of damaging the relationship, that's always the biggest one. And yes, sometimes we have difficult conversations and somebody, slams the door, leaves the room, says, I'm not talking to you. Um, and you need that cool down time, but you can always come back to the conversation. And that is the biggest thing is a lot of people after a difficult conversation, they just sweep it under the rug. But like I said, that kind of instills back in the person with the eating disorder that, see, it wasn't that big of a deal. They're being protective, they're being highly defensive because they're trying to protect the thing, their eating disorder, that in some way, shape, or form feels like it's helping them. Or it just feels so unbelievably like how could I ever live without this? And so, the ultimate damage to the relationship is your loved one not being around. And, every 52 minutes, somebody dies from an eating disorder. And, that's understated because not every person who dies from an eating disorder, we get that statistic that, might have been cardiovascular issue that they died from, but as a result of malnutrition from their eating disorder, right? So that's underreported. Um, the idea of feeling powerless or helpless. Um, and that's where focusing on what you need for your own safety, for your own peace of mind. If you can, start from there, I think you have a better option of thinking about like how to help my loved one, because you're only thinking about how is the loved one going to respond to this, or they're going to say no, therefore, like, there's nothing I can do. But if you start thinking about those limits and those boundaries that can empower you when any dynamic shifts in a family or, relationships, the other person has to shift too. And that's what's uncomfortable. Mixed messages within the family. So this is where I come to find that individuals don't necessarily like follow through with their limits and their boundaries. And so then that's the mixed message. You said that you wouldn't support me living in on-campus housing this semester unless I was in treatment, but I could still go to school if I lived at home. But then somewhere it got lost in translation, and you are allowing your daughter or your son, whomever, to live on campus. And so those types of things like mixed messages. So really identifying what your boundaries and limits are and sticking to them. And that's why, with all of these, the best thing you can do is to speak to a professional and utilize resources, because this is really very, like, just like it'd be too difficult for your loved one to try to do this on their own, they shouldn't have to. This is very difficult for any one of you to do this on your own. So please, I don't even need to list all the resources that I would recommend, because NETA has that on their website, including support groups and a therapist finder, things like that. So please utilize them. But thank you so much. Any questions you have, and you're also welcome to contact me if there's, further information or anything like that. But you will have these. This will be up on YouTube at some point in the near future, so you can always go back and watch this and look at this and share with your own families.
Thank you so much, Eleanor. I know we're over time, but we do have a few questions that came in. If we could just quickly touch on maybe a few. Um, One person said, my child is now 19 and living away from home at university. I have been cut off and don't know how to reach her anymore. She has decided to go no contact with her parents. Is this a common situation for children with eating disorders to do to their parents? And what can they do to reach out?
It is a very common scenario, and I work with a lot of college kids. Um, there's so many different avenues to try to figure out, and it's obviously all based on context. But you could always attempt to contact the school. Again, FERPA laws, things like that, you may not be able to get any information. But if you call, let's say their counseling center or their, disability support services, and just say, hey, I'm a really concerned parent. I know that this is going on with my kiddo and I don't know what to do. At least it's a way to have somebody else know that something's going on, and maybe in some way, right? Like the counseling center might like ask your kiddo to come see them, right? It could be a way to breach that barrier. Um, it could be that if there's complete no contact, right? Like if you're not providing any type of financial support, that also becomes difficult. But if you are in any way providing financial support for them to be in school and be in college, that would be something that you and whomever makes those decisions, um, you would need to talk about that, because again, to ensure their health and safety, I cannot fund you being in your eating disorder. I can only help support you financially if recovery is a part of it. I hope that helps. But again, speaking with a professional or going to support groups is going to help you kind of figure that out. What can I do? What's in my power?
Thank you so much, Eleanor. There's just one more question. In regards to teenagers going to a doctor alone, parents are often left out when it comes to treatment. Is there a way doctors can share with parents what they were working on with their patient without breaking doctor-patient confidentiality? And in this person's case, they were left out of their child's treatment and weren't told what was going on, or how they could help their child outside of sessions.
Um, Assuming you've probably already done this, but I'm just going to go to bare basics, is yeah, asking that specifically of the doctor, whether it means like you need to have a separate appointment with them, but hey, I need information on what to do to help, and what to do and what not to do, right? Um, Depending on the state and the limits of confidentiality, there are certain states where, if it's a minor, the parent still has the right to know things. Now, each practitioner in their own ethics might say, like, I will share some things, I'm not going to share everything. It could even be like, can we have a joint session? Like, can I come in here to ask my questions, right, with my kiddo in the room, and you all can decide what is or isn't appropriate to share, but I need to be a part of this because I know that it won't be helpful. Or if, again, let's say because you're not being involved because maybe you're the you're the reason why. Again, I don't necessarily believe that, right? But if that's the case, how are you supposed to change your own dynamics if nobody's sharing that with you? So I think you have a right to continue to ask of that doctor, that provider, because I mean, research indicates that having the help, having the support is important. So I'd like to know a little bit more about what that provider's like reasoning is behind it. And maybe that's where you ask, what's the reasoning behind not including me?
Well, thank you so much, Eleanor, again, for just an amazing presentation. Really just grateful on behalf of our community. Um, yeah, okay. And thank you, everybody, for attending, and have a great rest of your day.
Yeah, thank you, everybody.